Hello, everyone. This is Dr. Richard Fleming, and today is Friday, October 16, 2020. Darkness, true darkness, is not the absence of the light, but the fear that the light will never return. Those lines, well known to many of you, are very applicable to 2020 and the presentation and consequences of SARS-CoV-2, the virus that has colloquially been known as COVID-19. During these last 10 and a half months, this country and the world has entered a darkness, an area of fear, resulting from a failure to understand how to stop and prevent the transmission of this virus, as well as how to treat it, particularly among those individuals who are hospitalized. The responsibilities for addressing this virus do not belong to social media or politicians, for that matter. This is not a political discussion. This is a medical discussion. And the responsibility lies with the scientists and the physicians who have the knowledge to investigate and who are treating these patients. For that reason, the elected officials, including the President and Vice President of the United States, are not ultimately responsible for dealing with this virus. Truth be known, there is plenty of blame to go around in federal agencies, including NIH, NIAID, the CDC, Health and Human Services, FDA, and the World Health Organization. All agencies that claim a responsibility for addressing health problems in this country and around the world, and for trying to come up with answers. Each and every one of the individuals who are in charge of these agencies have failed. Unless you're aware of something I'm unaware of, none of these individuals have themselves taken responsibility for spearheading research into the diagnosis, management, and treatment of SARS-CoV-2 patients. While many of these individuals are heralded as our collective sphere of scientists to which the social media and media itself are trying to claim are the people to depend on, none of these scientists, physicians, or science physicians have done a thing to advance this research. Being in charge of an agency that doles out money does not make you responsible for answers. If you look at the National Clinical Trials website, last time I looked, there were over 3,000 trials. And all of them except one lacked 4 major items. 1, the ability to find something that could be measured and monitored as to the progression of the disease. There are 3 things that we have measured. FMTVDM, a quantitative nuclear imaging test, ferritin, and interleukin-6, the latter 2 being blood tests that track inflammatory diseases. Now, the first one is tissue specific and targets directly what's happening at the time of the patient, both upon entry into the hospital and following treatment response. The latter 2, ferritin and interleukin-6, lag behind and represent inflammation throughout the body. So if there are other things going on, they are slower to respond. So the first thing lacking in the clinical trials that have been published and talked about is a quantitative measure for determining how bad the disease is and whether treatment is working. Simply reporting whether somebody has a comorbidity like obesity, high blood pressure, heart disease, cancer, the list goes on, or noting whether they're on a ventilator, or noting whether they have been discharged or died, is not a very specific way, and it's not a clear-cut way for knowing whether the treatment is working or whether you just got lucky. The second thing these other clinical trials did not do is they did not begin with a medication randomly and then add to that medication every 3 days a new medication until an effect was achieved that successfully treated SARS CoV 2. By doing that, we're able to look at which drugs, either by themselves or in combination, work and when they work. Now, to be fair, if a medication produced worsening that was measurable by FMTVDM, ferritin, or interleukin 6, those drugs got discontinued. But if they provided no significant change, or they provided some improvement but not enough to be considered successful treatment, those medications were continued. The third thing that nobody did was to take the information from those drugs that were collectively added together in sequence randomly so that a wide variety of combinations occurred, was to take that original information and look at groups of drugs that seemed to work, and then to initially start treating people with those drugs. Had they done that, they would have discovered that the treatment drugs that work in combination address the immune inflammothrombotic response associated with the immune response to SARS CoV 2. And the fourth thing that was not done was the type of statistical analysis, in this case called analysis of variance, that allows you to put all of that information together and take and extract from it the actual impact of each drug and combine to find which drugs are most effective. When we did that, we started with 10 treatments, 10 individual drugs. And by doing the study in this way, we were able to study 52 treatment combinations to determine what works and what does not. This could have been done anywhere in the United States or anywhere in the world. And I reached out to the FDA, Health and Human Services, CDC, NIH, NIAID, to BARDA, to governors and states, to health departments in this country. And the answer that I got resoundingly back was, we have this under control. No, you don't. You didn't, and you still don't. As the rates of infection and the death rates from SARS CoV 2 continue to increase, the deaths of these individuals are not on the hands of the politicians, independent of which party or affiliation you might have. These deaths are upon the people in charge of the agencies, both federal and local, and the doctors and researchers who take care of SARS CoV 2 patients and have not done the diligent work of sorting it out. If someone like myself, who's a research physician, can coordinate an effort in multiple countries and get those people to work together for the good of the patients and come up with the answers for what the treatments for SARS CoV 2 are, there's absolutely no reason why the federal agencies in this country or the state agencies should not have been able to do the same thing. Yesterday, the results of our study was sent into the first journal. And I say first because, as you've undoubtedly heard me say before, there's no guarantee that a journal will publish outcomes. It's up to the journal. And this particular topic is so highly politically and socially charged that there are other factors besides science sitting behind decisions about whether to publish a paper or not. Once that paper is published, that information will be released. And the treatments available to successfully treat SARS CoV 2 will then be well known, and you can receive them. Make no doubt about it. This should have been done a long time ago. It should have been done by our federal agencies. It should have been done by our state and local agencies, it was not. It fell to people outside of the United States to collectively work together for the betterment of patients and science to find the answers for SARS CoV 2.